Now, the second focus on the show today, a new health complication arising from the treatment of COVID has raised concerns after 3 confirmed cases of avascular necrosis, AVN, or death of bone tissues have been reported from Mumbai. AVN has emerged as yet another debilitating condition after mucormycosis or black fungus affecting post-COVID patients, and this can be caused because of temporary or permanent loss of blood supply to the bone. But to explain it better, we're now joined by Dr. Sanjay Agarwala, Medical Director, Chief of Surgery and Head Orthopedics at Mumbai-based Hinduja Hospital. Thank you so much, Doctor, for joining us. You've written a paper also on this. If you could explain to us, what is this?
Thank you, Dharvi. Thank you for having me to talk to your audience about what is avascular necrosis. Essentially, avascular necrosis, as the very term says, avascular, no blood supply, and no blood supply leaving behind dead bone. When you get dead bone, it obviously becomes painful, and bone which should be hard like wood becomes soft like a boiled potato. When there is pressure on this kind of a bone, the bone collapses and the patient then needs surgery such as a hip replacement. Over 20 years of publications and research on this particularly vexing condition, we have shown that there are appropriate medications which can prevent surgery and are useful in the condition. Now, to our surprise, in COVID, we found that patients who had recovered from COVID, and one of the treatment protocols requires steroids, which certainly I would fully 100% endorse. It is life-saving. However, there is a possibility of a side effect of steroid which causes the death of this kind of a bone. It can be dramatic. However, it's very easily missed as a sprain, as some kind of an injury which will pass away. If the person has had COVID and has particularly taken steroid treatment and gets hip pain,
right,
he or she should go to the orthopedic surgeon, request him to recommend an MRI, and an MRI is confirmatory. Yeah, Davi, I cut you short.
Right, doctor, so if you could tell us about, the patients who had this, how did they realize, what were their ages, and what parts of the body does this affect most? Is there any information like that?
So one of the commonest sites of affection is the hip joint, and the hip joint is a weight-bearing joint. Unlike the shoulder, which doesn't take weight, the hip joint, being a weight-bearing joint, the bone which was strong like wood becomes soft. Like a boiled potato, it collapses. And once it collapses, the patient gets arthritis. These 3 patients, coincidentally, were all doctors. Being doctors, they had access to medical data. They knew how to do a Google search. And when they discovered that they had AVN, they came to seek my opinion. And we recognize this as a treatment, as a condition which would do well with medication. And these 3 patients have done extremely well. Now, it takes 6 months for a journal like the British Medical Journal to publish this data. And this
doctor,
was 6 months ago.
How many, how long after recovering from COVID is this being detected? Now, you say your 3 patients were all doctors, so obviously they were more medically, adept, and they knew about this sort of condition, which many of our viewers don't even know about. So when do you know that you need to consult your doctor if you're feeling some sort of a pain post-COVID?
So what my recommendation is that reach out to your doctor early. Remind him that you're worried about AVN being a possibility, and a simple test of doing an MRI will confirm whether you have AVN or not. Now, since we talked about it so many months ago, these 3 patients aside, we have actually seen another 20 patients since then. And as this has been coming in the media, I have had multiple colleagues of mine from all over India, phoning me and telling me, Sanjay, we have 3 patients we've seen. We've seen 8 patients, so clearly this is the tip of the iceberg.
So you're saying more and more cases are emerging of this. I mean, your paper is on 3 people, but you're saying more and more cases are emerging from across the country, especially since we know steroids were used so extensively during the second wave.
So to reiterate, steroids must be used. Please do not have patients saying they will not use steroids. But if you have had, as a part of long COVID, as part of your recovery, if you are suffering from pain of the hip, get an MRI done. And if the MRI shows AVN, Google Agarwala bisphosphonates AVN, you get the treatment protocol which you can then discuss with your doctor. Please don't try to rush and come to see me in Bombay. Go to your local doctor with the provisional potential diagnosis of AVN and start medical treatment.
All right, and again, so you're saying more and more cases of this are emerging. You're getting, you're getting doctors from other parts of the country actually calling you and saying patients are coming to them with this. That's
correct. Absolutely right.
All right, this is another, there's so many things one is still learning about COVID. I mean, of course, all you doctors are too. And this is just another aspect of long COVID that is now emerging. And you're saying, but the treatment, if caught early, it can happen, it can be treated. However, if it's not treated, what happens then?
So if it's treated, you can control it, you can cure it, it can reverse. If you do not treat it, then the bone will collapse and you will need hip surgery at the end, which is itself an excellent line of surgical treatment. But what I am recommending is that if you catch it early and you start the medical line of treatment, you can cure these patients. So if there is awareness, what the mind does not know, the eyes do not see. I would like those who are watching your program to recognize that this is possible. Reach out to your own doctor. Don't come rushing to me in Bombay. Reach out to your own doctor, get an MRI done, and then go ahead with the treatment.
All right, well, clearly there needs to be more awareness about this condition that can take place after you've recovered from COVID. Thank you so much, Dr. Sanjay Agarwala, for joining us on the program.
Thank you. Thank you for having me on.
Thank you.